Hello, it's Dr. Shelly from Shelly's Nursing Review in Cleveland, Ohio, and HETV, and I'm coming at you to help you win at the game of the NCLEX. If you just graduated, this is specifically for you. This is not for repeat test takers, although I guess you could get something out of it, but you probably could actually watch it and say, that's what I should have did, right? If you hadn't, if you failed before, you're gonna look at this and go, that's exactly what I should have done. So this is only for the new graduate. Look at this. 8 quick tips on how to study for NGN NCLEX as a new graduate. Yes, I'm specifically focused in this video on the new graduate taking their NGN NCLEX exam soon. Maybe you're graduating in December. Maybe you graduated already and you're kind of like, oh, I don't know what to do. Well, this will help you. Now, the deal is the number one thing you must do, because I find that when I talk to nurses, and yes, they have failed already. When I talk to them, I ask them, did you go to a good school? And they never know what the answer is. They go, oh yeah, I had some good teachers. I'm like, that's not what a good school is. Oh, well, yeah, I felt like I learned a lot. That's not what makes a good school. Well, what makes a good school? Duh, their NCLEX passage rate. That's what it's all about. You can't become a nurse. You can't walk in a hospital and do shit as a nurse until you pass the NCLEX exam. So guess what? This should have been done before you even enrolled in the school. But now that we're here and you're about to take your NCLEX, we've got to do the dirty work now. Your school ain't gonna tell you what their passage rate is. That's why you gotta look it up. So you need to go to your Google, Safari, whatever your search engine is, look up your school's NCLEX pass rate for the year before. Here's what I mean by that. Put in your school's name, ABC University or You and Me College or College of whatever or Institute for whoever, LPN and RN. I'm talking to both of y'all. So put in your school's name, just like I have it here, whatever your school's name is, put a comma. Here we go, boo. Put a comma and then put NCLEX pass rate 2023 if you're doing it now. If you're waiting until next year, NCLEX pass rate 2024. Next year is around the corner, a couple months, and we're into 2025. You must do it for the year before. Now, if your school's passage rate is not 79% or higher, then you are going to have a hard time passing the test, because that's really what they're saying. Their school is not that great. Now, that's okay. I got you. But I'm just saying, let's start off knowing what chance you have, what you have in terms of your education, how that prepared you or maybe did not prepare you for this exam. So that's number 1. Number 2 of the 8 quick tips on how to study for NGN NCLEX is to buy 60 to 90 days of UWorld RN and take the RN assessment as soon as possible. So the way UWorld RN, I'm talking to you LPN as well. It's gotta be UWorld RN. I'll explain it in a minute. The way this assessment test works is when you buy UWorld, not Archer, sucks. It's not hard enough. I'm tired of talking to everybody who failed because they did Archer. And it's not like you can't pass with Archer. Sure, you could, but you probably would have passed anyway, because Archer is like no level of difficulty at all. So I'm telling you what I know. I'm the one with the PhD. I studied this for a living. This is all I've done for 20 some odd years, plus work in a hospital, so that I know exactly what I'm talking about, okay? So when you buy the UWorld, you need to buy the 60 to 90 days, but you need to do the assessment in that UWorld right away. Now, when you do it, you have to pretend. You hear me, y'all? Role play. You have to pretend that you're at your NCLEX It has to be quiet. You have to turn off all distractions, TV. It needs to be when you're home alone. You need to prepare for the fact it's going to take you 4 to 5 hours. It's 100 questions. It's very much timed in terms of it's only going to stay there in the system in the UWorld format for you to be able to review for only 2 weeks. When you get this score, it's just your baseline. It tells you exactly how long it might take you to study. Now, I put 60 to 90, right? I put 60 to 90 days. How do you know whether or not you need 60 versus 90? You definitely need 90 if your school's passage rate was lower than that. You need 90 days if you ever failed a class in nursing school. You need 90 days if it took you forever to take your HESI, to pass your HESI or your ATI exam. You need 90 days if you know you're not the greatest student and your grades were barely getting it. Like maybe you got C's, which means C for continue to commencement. That's all C's mean. But if you are someone who did really well in school, you work at a hospital, this isn't that difficult. You just had to go through the motions to get the daggone diploma or degree or whatever it was so that you can take your NCLEX, and you felt confident and comfortable in nursing school, then by all means, get 60 days, keep it moving. When you take this assessment, no score is bad, but the scores that you probably want to be really cautious about is that if you have a baseline score, you took that RN assessment on UWorld and your score was below 60s. Yeah, you might be a while. You might need to go ahead and plan a 12 to 16 week schedule plan instead of a 6 to 12 week schedule plan. I'm keeping it real with you. I'm trying to help you out. You don't want to fail. Okay. Tip number 3 of my 8 quick tips on how to study for the NGN NCLEX as a brand new graduate is visit my completely free 500 plus, damn near 600 videos. Visit my channel, HETV. No one in the world put their entire nursing school on YouTube for free. Visit the channel, go straight to the playlist. Look up the playlist that says NGN NCLEX Self-Study Tips and Strategies. Watch videos 1 through 10 so you get an idea of how to study for your test. We go into detail about what subjects you should start with first, what would a 12-week plan actually look like, you know, how to set up your UWorld, how to do it, how to maximize your utilization of UWorld, okay? Tip number 4 of my 8 quick tips on how to study for the NGN NCLEX include plan for 6 to 12 weeks of studying. Make a schedule out of 1 subject at a time. In other words, when you are doing your studying, you're only studying 1 subject at a time. Never, ever study math. Did you hear me? Stop it. They don't have any math on 90% of these tests. When they do, it can't make you fail or make you pass. Stop studying math. No more math, okay? I know that makes you feel good. Some of you are multi-orgasmic about that. I know I would be because I hated math. Do not study math. The other thing, I don't even know why nursing schools made math a big deal. It was stupid in the first place. But because ain't nobody in no hospital gonna rely on your math skills to whether or not these patients gonna die. Nobody. Now, the other thing is, please do not put a lot of emphasis on case studies. I have case studies in my playlist. Look at those. That's it. They're free. Don't buy them. Don't get a book with them. Just don't, because here's what I know. I've been doing it 20 some odd years. You guys do well on case studies. They make sense. They kind of go along with the common sense. So you don't have a problem with case studies. You know where you have your problem at? oh my God, the rest of the NGN Test Plan. So you don't want to put all this emphasis in case studies when you guys do really well in case studies. Please focus on something else. So I hope that helps. All right. Tip number 5 of my 8 tips on how to study for NGN NCLEX if you're a new grad is to keep your practice quizzes small. Only do 5 to 25 question quizzes, but do a ton of them every single day, like 10 of them, 15 of them, as many as you can. On lunch break, you're doing it. As soon as you wake up, you did 5 questions. Before you went to bed, you did 5 more. You're at the lunch break at work, you tried to squeeze in 10. You need to do a ton of questions. Before you take this test, you need to have done every single UWorld question there ever was. You must do all 2,000 plus questions on UWorld. So keep it small, but this is why you keep it small, because see what happens is if you don't keep it small, it becomes almost impossible to review the rationales. And you are trying to make sure you review the rationales, and you are only doing one subject at a time. You are going to UWorld and you're pulling up psych. Psych is always first. Remember, everything I'm telling you right now, like every single thing I'm telling you is in the Oh My God packet. So you just need to text me 216-410-0936 if you want this really handy dandy nifty little study guide. It's only $35 for this year. Next year it's going all the way up because I know what I got, and I do not discount my value. Okay, so know your value. Don't give discounts when you know your value. This is going fast for $35. This year it will go up, but whatever, I'm not here for that. I'm here to tell you, review them damn rationales. Okay, all right, now tip number 6 of the 8 quick tips on how to study for NGN NCLEX when you're a new grad is 2 weeks. You hear me? 2 weeks before your test. Visit the HETV playlist and look up this, the NGN Test Plan. If you don't know what is meant RN by management of care, or if you don't know LPN, what is meant by coordinated care, that's what they're grading you on. It's 20% of your NCLEX. If you have no idea what basic care and comfort is, that's what they're grading you on. If you can't tell me what reduction of risk is, that's what they're grading you on. If you didn't know that pharmacology is all generic meds, that's what they're grading you on. But, you know, your girl over here has all of that. Every single bit of it. Management of care. We have your reduction of risk, which is also your basic care and comfort. We've got your infectious diseases, which is part of the test plan. Every one of these is part of the test plan. We've got your pharmacology. We've got the Oh My God packet. We've got 2024 medication categories. I mean, you know, we got you. We even got EKGs, and these come as a bundle. So if you need it, I got it. Just do it. Yeah. Okay, next. We're almost done. Don't worry. Tip number 7 of the 8 quick tips on how to pass the NGN NCLEX as a new graduate. Tip number 7 is if you failed any nursing courses, or it took you a little while to pass your HESI or ATI or whatever exit exam your school uses, you are high risk. If you got a C average, like your grades were usually C's, not A's, not B's, just C's, you are high risk. And you may benefit from taking a review course. Now, the good news is we do have our 3-day review courses. People come from all over the world, Saudi Arabia, Canada, UK, as well as in the continental US, Colorado, Texas, Florida, Georgia, hey, ATL, love you, Detroit, Michigan, Erie, PA, and Pittsburgh in the house. We even had somebody from Delaware and then Maine, California be all up in here. Y'all better come on, Texas and Colorado. Get your asses on up in here for 3 days. I will teach you how to pass this test. If you're a new grad, it's so simple. 3 days is enough. All right. Last but not least, number 8 of the 8 quick tips on how to study for the NGN NCLEX as a new graduate. Here we go. Drum roll. 1 week before your exam, take another UWorld test. This is your second assessment. Every UWorld subscription gives you more than 1 assessment test. This is a week before. Take another assessment exam. You must, are you listening? You must get an 80 to 85% if you're an RN, and you must get a 70 to 75% if you're an LPN and you're taking the RN assessment test. Now, don't bullshit me. Because when you call me and tell me some crazy shit like people do, they text me at the 216-410-0936. They text me and say, I followed your plan and I failed. Guess what I say next? I text them right back and say, okay, well, show me your UWorld assessment score before you win. One child had the nerve to fix her lips and tell me she ain't even buy the UWorld. The other child told me, I didn't get no 80s. I don't even think I got a 75. Oh, okay. Well, you know what? I love you, but you done fucked up because I told you not to take this test RN until you get 80 to 85 on this UWorld assessment. I told you, LPN, don't even bother to think about taking this test until you get a 70 to 75%. Now, I'm just keeping it real. And I just spent all this time because I need you to be a winner. Winners win, and you can do this. This is not impossible, but you can't just go out here blind and not know what the hell you're getting yourself into. You got to be a winner like the Cavs. You know, we number 1. Yeah, we in first place. That little shit that happened in Boston don't mean nothing. We are in first place. Hey, CLE Cavaliers. That was for free. So let's win, okay? Please, let's win in the game of nursing, because I'll just be honest with you, this is the best career I've ever seen in my life. It gave me my freedom, got me out of an abusive relationship, let my kids go all over the world. I mean, you know, property owner, got it like that. Now you get it like that. Let's do it together, baby. Boom. Deuces.